friends, I'm Dr. Hemraj Chandalia, Director of Endocrinology Diabetes at the Jaslook Hospital and my own center called Diabetes Endocrine Nutrition Management and Research Center. Today I'm going to talk to you about a very interesting topic, and that is the interaction of Indian culture with modern medicine. 55 years of my practice, I have found that our people are different. Each country's culture is different and people react different. And they perceive your medical help or medical profession differently. Overall, our population is poorly informed about the health issues. Then a lot of myths prevail, misunderstandings prevail, and they prevail in social media in the abundance. People are unwilling for a regular follow-up. So continuity of care is seriously affected in our country, and all patient ambulatory, especially outpatient treatment, is the patient has to pay from his or her own pocket, and that makes it difficult for them to take regular medical advice and continue treatment. And of course, we have multiple alternate systems prevailing in our country, like Ayurveda, homeopathy, Unani, Siddha. And this presents certain difficulties because people have different image of these alternate systems and of modern medicine. So we have to sort of be sensitive to this issue and deal with this very, very rationally and scientifically. You know that in our country, illiteracy prevailed to a great extent a few decades ago. And that time we conducted this study to see how do we educate illiterates or semi-literates, done in the Grand Medical College where I was teaching at that time. And you see there's a group of people here who are taken in groups and educated about diet. And you see here that their knowledge of diet, correct diet, improved considerably by short sessions with them in the native languages. Now, this slide shows the blood glucoses, and at that time, mind you, even the A1C was not discovered. In fact, we introduced A1C in 1980. This work is before that and published in Diabetes Care. It shows that postprandial as well as fasting blood glucose improved considerably. In our country, there is of course highly prevalent religions and spirituality, and each country you have to make note of that and probably also interact with this kind of practices and sometimes use to your advantages. Remember that some of these practices will introduce what is called restrained eating behavior, which is key to success in diet therapy of diabetes. So either you reduce the frequency of eating, quantity or types of food, and automatically you'll find that obese people start losing weight. So you have to use these spiritual and religious practices in this way. The doctor-patient relationship is very interesting in our country. See, you sometimes get a feeling that patient thinks you are the God, but after some time you realize that once they start getting well, sometimes they think you are a good human being, and obviously sometimes you give them a fat bill, they'll think you are the devil. So be careful about perception in their mind about you. And of course, remember that there is a trust deficit. It is part of our culture between the medical profession and the patients. And this trust deficit you have to be very, very aware of. You see, sometimes they use the word that you are professional. Mind you, in India, word professional is used for doctors who charge more, not for doctors who are practicing nicely. So be very careful what they mean when they say that doctor is professional. And remember that, you see, they are incommunicative or inaccessible and unethical. Some of this will be very interestingly, this is occurring for a long time. It is not against modern medicine alone. In general, our country has not looked at the health professional as very important part of their life. So this is a Sanskrit shloka, which means that, oh Vaidya-raj, welcome, you are brother of Yamraj, and that is the god of death. I bow to you. Yamraj steals away life, but you take away life as well as money. So you can see what respect even the ancient time was there for the healing arts. There are a lot of myths and misunderstandings which abound, and a lot of articles you can see on that, and those you have to dispel all the time. Indigenous drugs which are very acceptable to our population are low cost. The herbal products have very low toxicity. They are very widely accepted by the population, and they are very easily available. And I would also add that we may find that some of them are suitable for prevention. For example, primary prevention of diabetes, they can be considered. You should be aware of the fact that there have been good scientific studies on the Ayurvedic compounds. And a journal which I edited called International Journal of Diabetes in Developing Countries, which is mouthpiece of RSSDI, I published in 2 years' time 6 studies on the herbal products, from Burgund tree, from fenugreek seeds, and similar ones listed here. As these Ayurvedic drugs in those studies were shown to be mildly effective in lowering the blood glucose, the thought came to my mind, can we mix up these remedies with our modern medicine? Overall, side effects of these drugs is much lower, and whenever we use in patients, in case there are any side effects when you use mixed therapy, the side effects will be always attributed to modern medicine, while all beneficial effects are attributed to the herbal drugs or Ayurvedic products or similar products. So you have to be fully aware of when you use the mixed form of therapy. So let us see how we put the alternate system in diabetes. For example, Ayurvedic compounds can be used in the first 1 or 2 years of type 2 diabetes, where in fact the disease is reversible even by simple diet and exercise. They can serve as an adjunct there. Also, very interestingly, you can use these compounds probably for the prevention, and I think they have been studied by many authors for prevention of type 2 diabetes. So I pose a question to you. When you are treating your patient and patient wishes to continue the alternate system along with your medications, what approach you take? And this is food for your thought. I would say that we have to very slowly integrate some of the alternate system with modern medicine, give them a rightful place, like I told you, herbal products in early stages of type 2 diabetes and prevention. So friends, thank you for listening to this topic.